over to Claire, and she's going to tell you about what she found when she interviewed our housing support staff and the tenants of public and community housing. Claire, are you ready to go?
I am. Hello, everyone. My name is Claire. I'll be presenting the findings of the research project that I began during my social work student placement with Housing for the Age Action Group in late 2019. The findings of the research project have been collated into a report entitled Public Housing and Community Housing, Comparing the Rights and Experiences of Older Tenants in Victoria. The report is available on the Housing for the Age Action Group website in the publications section. This report provides comparison of the rights and experiences of older tenants in public housing and community housing. The research topic was chosen in response to current social housing policy involving an increasing shift away from the provision of public housing, which is government owned and managed, to the growing community housing sector, which is owned or managed by non-government and not-for-profit organisations. There are key differences in the policies and decision-making guidelines for public and community housing. The main differences, which are the focus of this report, relate to housing offers, tenancy allocation, rent setting, and accessibility modifications. For example, public housing is prioritised applicants at the top of the Victorian Housing Register waitlist, with rent capped at 25% of total household income for all tenancies. On the other hand, community housing organisations have varied tenancy allocation targets, meaning that not all housing is allocated to applicants who are on the waitlist. The rent for low-income tenants is up to 30% of income plus Commonwealth rent assistance. These differences have a direct and significant impact on the lives of tenants. This report illustrates these differences from a tenant's perspective. It also includes the perspective of housing support workers to provide insight into the processes for accessing both public and community housing. Ultimately, it's hoped that this report will assist with advocacy towards greater access to public and community housing, improved regulation, and strengthened tenancy protections for older tenants. The aims of this report are underpinned by HAAG's vision for a society where older people have safe, secure, and affordable housing. This report acknowledges that housing is a public health issue and a fundamental human right. It also acknowledges that people aged 55 and over are the fastest growing cohort of Australia's homeless population. It is therefore important that housing policy is responsive to the needs and the experiences of this demographic. The findings in this report are based on interviews with 18 older tenants in Melbourne. Half were residing in public housing and the other half in community housing. Participants were all over 50 years of age and had been in their current tenancy for a minimum of 6 months. The participants were former clients of HAAG's Home at Last support service and responded to an invitation to participate in the research. The interview questions were structured around the following key tenancy policies: rent setting, maintenance, modifications, and access to information about tenant rights. Participants were also asked about their experience of applying for, accessing, and living in public or community housing. 5 housing support workers from HAAG's Home at Last service were also interviewed. Questions focused on the workers' experiences in supporting clients through the housing offer and sign-up process for public and community housing. I will now outline the key findings of the report, beginning with the experiences of the housing support workers. And this illustrates how tenants access public and community housing and the differences between the two. A significant difference was reported between public and community housing with the decision-making guidelines, the processes and policies for tenant selection and housing offers. On the left-hand side of the presentation, there are other key findings relating to public housing. The public housing processes for tenant selection and housing offers were described as consistent and transparent. Housing offers consistently prioritised applicants at the top of the Victorian Housing Register waitlist, according to demonstrated need and housing suitability. Rent policies are transparent, are clearly communicated to tenants when they sign a residential tenancy agreement.
That's what she's talking about.
Another key finding is that the supply of housing allocated specifically to applicants over the age of 55 are often already modified to support accessibility and mobility, and certain modifications can generally be made and paid for by the department to support ageing in place.
That's shocking, isn't it?
I'll now turn to community housing with the findings on the right-hand side of the presentation. The processes for community housing for tenant selection housing offers are varied and less transparent. Housing allocations are not necessarily targeted to applicants at the top of the priority categories of the waitlist. An eligible applicant may be required to progress through pre-offer activities, such as a group interview, before being approved for a housing offer. The findings demonstrated that allocation processes and policies for community housing allow for greater discretion by providers when selecting tenants. The experiences of housing support workers indicated a tendency for community housing providers to preference applicants with higher incomes and low support needs, resulting in discrimination against applicants based on income, circumstances, history, mental health, physical ability, and assumptions about their character or cleanliness. Consequently, applicants on the lowest incomes or with additional health support and mobility needs are left with fewer housing options and prolonged exposure to homelessness or precarious and unsafe housing. The following quote from one of the housing support workers summarises this point. It's interesting to see how different the providers work, and we try and help the client as much as we can by ensuring they're not disadvantaged by this situation. So working with that to get them housed is sometimes really difficult. I'll now lead on to the findings from the interviews with older public and community housing tenants, and I'll begin with public housing. The report identified some similarities between the experiences of public and community housing tenants. However, there were some significant differences. Overall, public housing tenants were happy with their tenancy and experienced their housing as a home and a haven. This experience was strongly linked to their security of their tenancy, the transparent and reliably affordable rent, the ability to have the property adapted to support aging in place, and the responsiveness of their housing management. These conditions provided a stabilising and life-sustaining foundation. And the following quote from one of the public housing tenants captures this point. All I can say is that I'm just grateful. The best thing that ever happened to me was finding this place because it gave me the security. Your home should be your castle. You're safe. I would not give that up for anything in the world. Experiences of community housing tenants were more varied. The majority of tenants, just over half, were happy with their tenancy and reported an increased sense of security and well-being. This is illustrated by the following quote from a community housing tenant. I'm sort of overwhelmed with how good it is. I think this is it for me. Nobody can chuck us out now, which wasn't the case when we were in private rental. It does give a feeling of stability. The experience was quite different for just under half of the community housing tenants participating in the study. Common themes included unclear and unaffordable rent and a lack of clarity concerning providers' responsibilities to tenants with regards to affordable rent setting, maintenance, and modifications. These tenants experienced stress, some financial hardship, and lack of control over their lives as a result. As one tenant put it, I'm really no better off than in private rental. For community housing, tenants were less clear about how their rent was calculated. Some were unsure whether or not they were paying more than 30% of their income. In some cases,
where are you calling me from?
Tenants on the same income payment were paying a different rent amount to the same housing provider. Some tenants had requested a breakdown of their rent calculation, but it was not provided to them. Community housing tenants were also more likely to struggle to afford other necessities. As one tenant stated, there's been times when I've gone without food, just scrape money together. Fortunately, for my daughter and son-in-law, I do a lot of babysitting for them, where I'm not here wasting power and buying food. Finally, a significant finding across both public and community housing was the feeling of gratefulness for secure housing. Participants were acutely aware of the inadequate supply of public housing and the relative fortune of accessing a safe, affordable, and secure home. Consequently, some of the participants expressed a reluctance to complain or raise concerns with regards to issues such as maintenance or rent affordability. To illustrate this point, I'm going to read a final quote from one of the participants who was describing their experience after having just moved into their new home. The housing manager had asked if there were any maintenance issues. When I first got in there, I was so grateful I got a place. He said to me, 14 days, you check and see what you've got. But I was just so grateful to get a place. I didn't want to complain. I was scared by complaining. They're going to throw me out in the streets again. I was just grateful I got a place. I'm home. I don't want to go out there again. In conclusion, the policies that shape access to and the delivery of public and community housing bear a direct impact on tenants and carry significant consequences for vulnerable groups of the population, as demonstrated in the findings of the report. The findings clearly stress the importance of protecting and investing in public housing as a secure, affordable and non-discriminatory housing option for older tenants. It has also demonstrated that tenancy policies and processes work well where they are transparent, consistent and equitable. This highlights a need for community housing to be held to the same benchmarks for tenancy management as public housing, including clear and transparent policies that apply to tenancy selection, rent setting, maintenance, and modifications. Finally, I'd like to thank all the tenants and the housing support workers for their generosity in sharing their time and experiences with me for this project. And thank you all for listening.
But I encourage everyone to have a look at the report. The link to that is in the chat and it's on our website. And we're going to be using this to advocate for improved tenancy management. So thanks, Claire.